Hey everyone, welcome to the latest installment of Phoenix Children's Live. We are ready to go here today. Today we're going to have Dr. Tom Sitzman, pediatric hand surgeon, with us. How are you doing today?
Great.
Thanks for being with us. So before we start, just wanted to always throw that out there that we would love to know you're out there. Throw us a like, a love. We'll also try to answer questions as we get them. And if we can't get to them right away, we'll get to them afterwards. So don't hesitate to send some questions through as we do the installment today. So with that, let's get going. I'm your host today, Peter Balistreri. I'm a brand manager with Phoenix Children's, and we'll jump right into it. So first, tell us briefly who you are and what brought you to Phoenix Children's.
Yeah, well, my name's Tom Sitzman. I'm a pediatric plastic surgeon and a pediatric hand surgeon. A huge part of my practice is taking care of kids with hand injuries, whether that's an injury from a sport or getting a finger caught in a door. And then the other big part of it is taking care of kids who are born with congenital hand differences.
Let's talk about that, because I think that's kind of the two big areas that you probably see, and something that I wanted to educate our fans and followers on. So when we talk about congenital versus injuries, let's kind of talk about both. Let's first talk about congenital. How do you know that when those are going to be happening, and how do you treat those?
Yeah, well, nowadays ultrasound has gotten so great that quite frequently people have seen an ultrasonographer and they found something in utero, and so they'll often meet with me before delivery to sort of talk about sort of what they found and what we think. But still a lot of families too, they find out really when their daughter or son is born and they see a congenital hand difference. We usually like to see families early on in the first month or two of life, and then develop a surgical plan. And for many congenital hand differences, that means surgery around a year of life, sometimes later, sometimes earlier. But we like to sort of form that plan in the first few months and let all the family members know kind of what to expect.
So staying on the congenital hand things, let's talk about what do you commonly see? I mean, I think I've known some families that may have had a child with maybe missing fingers or something along those lines. But what are the typical things that you see in terms of that congenital hand situation? Yeah,
so the most common things are syndactyly, or what people call webbed fingers.
Okay.
And then extra fingers. Oftentimes there's a little extra finger on the outside of the small finger. Sometimes on the outside of the thumb, there'll be a split thumb. Those are the really most common. Younger kids will get a triggering or a locking of their thumb. Their thumb will get caught down and won't be able to straighten up. And so that's another condition. We usually, those kids, it kind of gets noticed when kids are closer to a year of age as their hands start to open up. Then there can be a lot more complex differences. So the thumb can be small or even absent, in which case we have to create a thumb that works well.
Wow.
And then sometimes there can be more complex either absences or fusions of the fingers. So
with that being said, pediatric hand surgery, there's a great deal of plastics that are involved with that. Talk a little bit about that. Maybe those last couple of examples. You need to create thumb or add to thumb or like you said, some of the absences. Is that kind of where the plastics comes in then?
Yeah, a little bit. I mean, congenital hand surgery, it's art and technical skill. And so the plastic surgery part definitely gives you a lot of insight. Most pediatric hand surgeons are either plastic surgeons or orthopedic surgeons. And there's this nice fusion that happens when you get access to both. So in my own training, I did one fellowship training with plastic surgeons and then another one training with orthopedic surgeons to kind of get that combination of expertise. But there's definitely a bit of art to things and understanding how sometimes what appear to be very complex problems can come up with solutions that leave kids with really, really fantastic functioning hands.
That's awesome. So in terms of the abnormalities and then the congenital versus the injuries, is there one that you see more often than another, or are they kind of split, or how does that work?
Absolutely. The most common by far is injuries to the hand. So 1 in 100 kids is going to get an injury to their hand or arm each year.
Wow.
So it's really over 10. By comparison, 1 in 1,000 children who are born are going to have a congenital hand difference. So most of what I see and take care of is children with injuries, whether that's from sports, particularly in adolescents and teenagers when they're getting out there and being active in football or basketball or volleyball. Do you really name the sport? And younger kids, like toddlers, they're interacting with the world. So they're falling, off the furniture down the stairs, or they're putting their fingers in crevices and holes and getting them caught in things.
Yeah.
This is, these are what happen to children, and that's the large majority of my practice, is taking care of those children.
Yeah. So do you work closely with our new, well, now it would be our new ED and trauma center? I mean, do you kind of see them after things have been kind of triaged and calmed to the point where they can make appointments with you? Okay.
Absolutely.
Yeah.
So I've worked closely with our emergency room and urgent care doctors, and really what we try to do is the emergency room doctors are going to stabilize you. If there's anything that needs to be done that night, they'll arrange for that to happen.
Yeah.
But if it's the kind of thing where once you have the diagnosis, you can get splinted and get told to follow up, we really make it available so that we can see everybody within 10 days of when their injury happens and kind of get that definitive or final management.
So with I'm jumping back a little bit to the congenital ones.
Yeah.
When you notice that there is an opportunity to fix a child's hand, what's the kind of the path that happens there? So you identify it, and is it something that you do have to wait a certain amount of time? And then what happens after they have the injury? Is there I can't imagine rehab is kind of a tougher thing when you have basically an infant.
Yeah.
So how does that work?
Yeah. So children who have congenital hand differences, oftentimes you need to wait for them to get bigger and for the structures of the hand to get bigger to do a lot of these more complex surgeries.
Yeah.
So while we'll see them at the first few months of life, and we'll come up with a plan, if that plan, and particularly if it involves multiple surgeries, we set everything to happen, or at least start in motion at a year of age.
Yeah, because they're not grabbing anything, they're not manipulating.
Yeah, exactly.
At that point, right?
For the first 6 months, they're not really reaching out with their hands to use them in that way.
Yeah.
And so there's plenty of time, and if the structures are bigger, they're easier to work with and get more reliable surgery.
Yeah.
The anesthesia risk also goes down a bit once kids get a little older and bigger.
Yeah.
And then, we plan for surgeries starting in a year of age. The nice thing is that the very young children, once you take the dressings off after surgery, they want to get to using their hands. They do a lot of their rehab just by enjoying, the world, interacting with their siblings and their parents, and playing with toys.
Yeah.
Sometimes we do need more intensive hand therapy, particularly for kids who have more complex differences.
Mm-hmm.
And so I work really closely with our occupational therapists.
Oh, yeah.
Oftentimes we arrange for people to meet the occupational therapist even before surgery to have an idea of what to expect.
Are we talking months there, or weeks, or what's kind of a typical?
Yeah.
I know it's probably a tough question.
It's a bit hard. I think for kids that we know there's an occupational therapist in their future, we'll meet them usually a few months before surgery just to sort of establish a little bit of a rapport.
Mm-hmm.
They'll see them at the first clinic visit after surgery, which is usually about a month after surgery.
Yeah.
And then they'll work with them pretty intensely for a few weeks to a few months to get them where they need to be.
Yeah.
So it's a pretty rapid improvement.
Oh, that's great.
On the traumas, on the side of kids who have injuries, so they broke a finger, most of those kids were able to get seen within a week, sometimes a week and a half.
Yeah.
Get kind of a definitive management, and then many of them are stiff afterwards.
Yeah.
And so that's when we get them working with the hand therapist. Those injuries, they often get better within just a week or two of in terms of getting rehab done.
Do you does hand surgery require casting most of the time, or is that case by case? And kind of how's that work?
Yeah, in my practice, I use a lot of casts.
Okay.
For the adolescents who have injuries, they like to cast. In many cases, they can go back to playing sports or being more active.
Yeah.
We have waterproof casts, so it's pretty easy to take care of. You can get it wet in the shower or the bath.
Yeah, that's a tough thing to keep dry when you got young kids.
Particularly around here in the summer, where people really want to go swimming.
Mm-hmm.
The other nice thing is for little kids, if I'm really worried about protecting a broken bone, there's nothing more secure than a cast.
All right.
So I sort of say my job is to come up with some way to immobilize them that'll let it heal, and they can keep living their life. Because you're not going to keep a toddler from climbing up on the sofa.
No.
But my job is to put on a cast that will protect the kid when they fall off the sofa again.
And it will happen again, right?
It'll happen. Because kids are active, and that's what we want them to be.
Right.
I use a lot of casts.
Okay. Well, talk a little bit about kind of what you bring to our hand surgery program here at Phoenix Children's. I know that this is a burgeoning area. We have more and more kids here. We're the fifth largest city here in Arizona and across the United States. So a lot of kids, a lot of injuries, a lot of things to take a look at. But what does that mean for a hand surgery program as we go forward?
So the hand surgery program here is really the opportunity to build it is what attracted me to Phoenix. I like to point out to everybody that the Phoenix Children's logo is a heart in the middle of a hand.
You're right.
So it's pretty central to at least what I think the mission of Phoenix Children's should be. But these children, I think you interact with the world with your hands. And so having kids use their hands and treat those injuries and the differences, that opportunity to build that program really brought me here. It's been fantastic to really build collaboratively with orthopedic surgery and sports medicine, as well as plastic surgery. And so for upper extremity problems, all the orthopedic surgeons will take care of children who have wrist fractures and elbow injuries and forearm injuries. The sports medicine physicians, many of our team there, will also treat kids with hand problems. And then from a surgical side, I treat most of the hand problems in the hand itself and the wrist.
So
but really, I think we want to grow that program over time and be more available. I believe strongly that kids are not big adult or little adults, and they deserve specialized care. And so caring for them at a facility that can really be pediatric focused from the front door all the way through the care experience, I think is important.
I'm glad you brought that up because I think, first of all, I think it's important that you are working with all those different areas within Phoenix Children's, kind of that continuum of care, right? So that they get all those specialties under one roof. So I'm glad you explained that, to work with sports med and ortho and all those great areas. But I'm also happy that you brought up the fact that this is a kind of an ongoing, and it's a chance to build a department or build a program, if you will. So we can even see more of the complex procedures as we go forward, and kind of are you hoping that you become kind of a center of excellence, if you will, in the Southwest? I mean, I would think that's kind of where we're moving.
I mean, my goal is that we build a team that can provide the entire range of services for kids with hand injuries and congenital differences, and that we really become, particularly in Phoenix and in Arizona, recognized as a center of excellence and the place that comes to mind. And doing that is really, it's a big goal. It's going to take a lot of time, but everyone from orthopedic surgery and sports medicine, plastic surgery, occupational therapy, and rehab, they're all on board. And so I think it has all the foundations to be a good team.
It's funny. I mean, you kind of humor a little bit with the logo, but I think there's something to that in the fact that also, I think as parents, I think sometimes the hand. We'll get around to it. If there's an injury, if it's not terrible, okay, we'll get to it. As opposed to a child's eye or a neuro injury, something along those lines. But talk about there might be some real issues if something's left for too long. And I don't know that it might be arthritis in their future or anything like that, but I've heard that if you have an injury to a hand and left for a long time, there can be complications later down the line. Kind of talk about that in terms of if our parents are watching and they're trying to figure out if they should take their child to a specialist.
For a lot of the injuries that kids have, right away something's wrong. And that's when they fall off the furniture, or they have the accident during a game, and all of a sudden something hurts that didn't hurt before, and it hurts bad. If it's a fracture or a ligament sprain, we really want to see those kids and make the diagnosis and start the treatment within a week and a half or 2 weeks. If we wait more than 2 weeks, the bones can start healing in the wrong way, and then we have to re-break the bones, and it's just a lot more discomfort and not quite the outcomes as if we see them earlier. That being said, for most of those injuries, after you get kind of the initial visit to the emergency care, the urgent care, or your pediatrician's office, you can wait a couple days to let the swelling go down, so you don't have to be seen by a hand expert that night. Obviously, there's kids who have much more complex or devastating injuries where the hand gets trapped in something, where they lose blood flow to their finger, and it's a bit different, and those kids need to come to the emergency room, and they're often going to get surgery right away as an emergency.
Talk about the other thing too is I think that people oftentimes will. Well, I'll take my my child anywhere, but there's definitely a reason, and we talked about this a lot when we talked about the new trauma center as well. That it was level 1 pediatric trauma, but I think the same goes for hands. Why should they go to? Why should parents take their kids to actual pediatric hand specialists? Yeah. I think the one thing I heard about is there's growing that's still happening in their hands, the growth plates on the bones and things like that. But why else would a parent be a good choice to take their child to a pediatric hand specialist? Yeah.
Pediatric hand problems are different. Growth plate injuries are different. The management is different. Yeah. The other thing that's a bit different is because kids are growing, our tolerance for how well we want things to be aligned and how fast we let them back to sports can be different as well. Mm-hmm. I think also it's about the whole care experience, right? So if your child has a hand broken bone and they need surgery, you'd like to know that the anesthesiologist is a pediatric anesthesiologist. Mm-hmm. You'd like to know that everyone in the operating room is used to taking care of children every day. Yeah. I think that's the same thing with our when we're putting on casts. I mean, the people who work in our facility and do casting, they cast kids every day.
And they're amazing too. He's telling the truth on that, definitely.
And so I think that thinking about every person that interacts with your child during their care experience, does that person see the child as a child and treat them in that role first and foremost? And so to me, that's why you want to go not just to a pediatric provider, but to a pediatric facility. Yeah. And that's why I have spent my life working in pediatric hospitals and really enjoy, the care environment where everyone at Phoenix Children's is here because we care about taking care of children. Definitely. And that's our primary perspective.
Definitely. The congenital injuries again too. Are there any groups that are more apt to getting those kinds of things that you see as a congenital hand injury, or is it more males, females? Yeah. Is there any races? Anybody have more of an opportunity?
It's really all over the map. Yeah. Boys, for many of the problems tend to be a little more common to have congenital hand differences.
Okay. For whatever reason.
For whatever reason. Yeah. For the most part, not really that well understood. Mm-hmm. There are definitely some where it runs in families. So I've met many families who they have a child with syndactyly or a webbed finger, or particularly an extra finger on the outside of the hand by the small finger, and they'll say, "Oh, I had that as well," or my brother had that. Yeah. So that can be running in families more.
Those hereditary.
Yeah. Okay. Most of the time, we really don't know what causes it.
Okay.
It's just kind of sporadic. Yeah. We often, their hand problems at birth can be associated with other birth problems, and so we always do a careful screen to make sure there's no other health problems. And the other, I think, again, you talked about being in a pediatric facility, right? Yeah. So if you're worried about a child who has a hand problem and might have a heart problem, well, we're the place you don't want to go to an adult heart specialist. You want to go to a pediatric heart specialist.
Right.
And again, that's here. So I think providing that comprehensive pediatric focused care is a big driver.
Well, in terms of this program kind of getting off the ground and kind of really forming and you being a big part of that, are there other specialties involved in this program as well? I mean, I think you talked a little bit about the ortho and the sports med, but and it kind of branches out into all those areas, but are there any other areas that kind of touch point in there too?
Yeah. So by far and away, orthopedic surgery and sports med are the keys and really fundamental collaborators in the initiative.
Okay.
Rehab services, occupational therapy, and physical therapy play a huge role. Yeah. A lot of the brachial plexus surgery, or kids with nerve injuries in the shoulder and neck, those are cared for through our neurosurgery department. Yeah. So collaborations there.
Okay.
Those tend to be the core.
Yeah. Which is great. You're touching all those main areas. Yeah.
So in terms of, okay, if there's a parent out there that has a child that really wants to look into getting the child into this program, what's the typical way that they do that? Do they make an appointment? Do they need an referral? How do they do that?
They can really just call.
Okay,
it's the simplest way.
Yeah.
Call our offices. The number's 602-933 0500.
Okay.
Or they can just call either the plastic surgery or the orthopedic surgery clinics, and they'll get scheduled. And we'll find them the right provider at a facility that's close to them.
Yeah, that's great.
Pediatricians can also send referrals over, and we'll facilitate those.
Okay.
I think particularly for kids with hand injuries, time is of the essence, and so we often find that if we give that family that number when they're in the emergency room or the urgent care, they're going to call right away and get coordinated care.
Perfect. So are there what other services are there for patients and families with the congenital hand abnormalities? Are there anything else that they need to know, or did we cover all of that?
Yeah, we covered a lot of it. They're very unique.
Yeah.
And the other thing that is important is particularly for children with more complex hand differences.
Yeah.
Having the opportunity to connect with other children who have the same kind of problems can be nice.
Mm-hmm.
And so in the last few years, there's really developed some really strong national patient and family networks.
Yeah.
And so we're always happy to help families connect to those, particularly the Lucky Fin Project.
Yeah.
To sort of find another family and another child who has a similar condition, has been through surgery or decided not to have surgery, and can talk a little bit about their own experiences.
Yeah. Well, how often, do the congenital ones happen? I mean, is it? I think as a parent, and if you're having a child and you get worried about 10 fingers, 10 toes kind of thing, right?
Yeah.
I'm sure you hear that all the time. This
Yeah.
is like something that's actually fairly normal, right?
Yeah. So every 800 children that are born, about one of them will have a congenital hand difference of some type.
Mm-hmm.
Some of the more common ones, like webbed fingers, are that's maybe 1 in 800, 1 in 1,000.
Yeah.
Whereas other things like being born without a thumb or
Yeah.
with a very small thumb can be much more rare.
Yeah.
1 in 10,000 or 1 in 20,000.
Okay.
So it's pretty uncommon
Yeah.
overall when we think about what are their common injuries. Again, I always sort of refer people back to 1 in 100 children each year is going to injure their hand.
Yeah.
The analogy one might make is of all the children in an elementary school, 1 or 2 of them will have a congenital hand difference.
Yeah, that makes sense.
But each year, someone in each grade level is going to break a finger or an arm.
Yeah.
So quite different.
Yeah, and we have so many kids that are doing sports now, and I'm sure that's probably probably going up maybe as we
sports participation in general is going up,
Yeah.
and then the intensity of the sports is going up as well.
Yeah.
And so we catch ourselves with our hands, that we reach out and interact with with our hands, and so common injuries to happen. The good news is that for most injuries in kids, they heal really well.
I was going to say, kind of, what is the outcome when are you going to get back to full movement? And...
So for most injuries that kids get when they play sports or toddlers have when they're adventuring into the world, the outcomes are really fantastic.
Yeah.
4 weeks of immobilization, a few weeks to kind of get their range of motion back and to get their strength back.
Yeah.
And at 6 weeks or 2 months out, most kids are back to doing everything they really were doing before.
They heal faster.
They do. It's nice. It's nice, and it really is one of the reasons I enjoy kids so much, is that they're fantastic healers. And I always tell people, my job is to put them in the direction to heal well, and then stand out of their way so they can heal as fast as they can and get back to doing what they want to do.
Yeah, excellent. Well, I feel like we covered pretty much everything here. I really appreciate your time and hanging with us today at Phoenix Children's Live. Thank you so much.
Thank you. It was a pleasure.
Yeah, if you have any questions, you gave the phone number. They're always around, and please, again, if you have any questions, let us know. We'll get back to you as soon as we can. But thanks for being with us today, and get ready for the next installment of Phoenix Children's Live. Take it easy.